So, very warm welcome to one and all present over here. So, I welcome you all in our ISFCP dialogue series under the aegis of IQAC-IIC, organized by ISF College of Pharmacy, Moga. Today, we have with us our speaker of the day, Professor Anil Kumar, who is currently serving as a chairperson in the University Institute of Pharmaceutical Sciences, Panjab University, Chandigarh. Professor Kumar, he did his PhD and M.Pharm in the pharmacology from the Panjab University, Chandigarh. And with his excellence of research in the area of neurodegenerative and neuropsychiatric disorder, he was recognized as a world top 2% scientist in the pharmacy and pharmacology field. He is also the member of CPSCA. So today he delivered his talk on animal ethics, basically the 3R principle. So we welcome you, sir.
So thank you, Aarti. Dr. Gupta ji, thank you. For Dr. Siddharth is also here. Thank you,
Just
Dr.
I want
Siddharth, Dr. Gupta
to
ji.
2 minutes, sir. I will
Good afternoon,
take.
sir.
So thank you very much. And first of all, I congratulate Dr. Anil Kumar ji for the chairmanship, Department of Pharmaceutical Education and Research, UIPS, Chandigarh University. And this is the great opportunity with the hand of the dynamic head and experienced person. So my lot of good wishes, and on behalf of ISF Dialogue Series as well as ISF College of Pharmacy, I welcome you from core of my heart. And
Thank you,
I am
sir.
thankful to you for accepting our invitation and provide the great opportunity to the scientist, researcher, and pharmacology person to listen you, and they will also opt these things in their future also. So, sir, I just want to mention over here, IQAC coordinator Dr. Siddharth Mehanji over here. Under the coordinatorship, this IQAC dialogue series is going on, and our team member, our faculty member, we have decided to organize 101 hours. This is the dialogue series, and I hope that if the things to be the allowed and persons are available to contribute for the profession, then I will try my best to go up to the 365 days. So thank you very much, Dr. Aarti ji, for provide this opportunity to interact such a very nice, down to earth person, Dr. Anil Kumar ji. So again, I welcome and thank you, sir. So over to you, Dr. Anil ji.
Thank you, sir. So will not spend much time. Let me jump direct to my topic. So let me share my slide, then we'll discuss one by one. आरती, मुझे थोड़ा बताना कि आपको दिखाई दे रही है मेरी स्लाइड? आरती,
Yes, sir. Yes, sir.
आ रही है?
सर आई थिंक आपने स्क्रीन शेयर किया है, आप स्लाइड प्रेजेंटेशन शेयर नहीं हुआ सर अभी।
आ गया है, देखो।
No, sir.
दिखा?
नो सर, अभी नहीं दिखा।
Okay, just wait. ये कुछ ज़्यादा खुल गया मेरे ख्याल से कुछ।
जी।
एक मिनट ऑफ करो। वेट, आप मुझे स्टॉप करो, मैं दोबारा से ज्वाइन करता हूँ, मोर बेटर।
ओके सर।
ये बहुत ज़्यादा ओपन हो गई है फाइल्स। लेट मी अगेन ज्वाइन।
Yes sir, now it is visible.
Okay. दिखाई दे रहा है आरती? Will you be able to see it?
Yes.
Arti, can you see the slide?
Yes, sir.
Okay. So let me first of all thank you all for inviting me, particularly Aarti and Dr. Gupta, for sharing my views on this issue, animal ethics and 3R principles. I kept it as such because this is one of the important topic that one has to know it, why we need to discuss the ethics in experimental animals and what is the growing concept of 3R, which is nowadays it is not a 3R but it is a 5R concept. But we always talk about 3R because it was the genesis. It is basically the 3R was started from the beginning and now it is added two more R's into that. So this is now currently it is a 5R. Okay. So before actually discuss this 3R concept, or which is now translated to the 5R concept, one has to know where we are generally use the animals, and what is the need of using 3R concept. It is very important that you all aware that when we use the animals, animals are generally used for the preclinical research, right? And in the preclinical research, where the animals are the basic tools to study the disease pathology or to study the toxicity or different types of studies, in vitro studies, we generally use the animals. And it is very important nowadays a concern that whether we should use animal or not, whether the animals are providing the correct information for about the disease pathology or not. Why? Because when we use the animals as a data for clinical studies, this same data is not translated equally in the human beings in terms of clinical trial, and that is what majority of the drugs faced during the clinical trial, because the preclinical data is not translated in a true manner as we generally assumed or predict. So that is what it is very important to know the deficiency or the weakness in the model and what are the important feature of animal as an experimentation. And there is a lot of you can say arguments are there. So let me start that story from there. And you all aware in the drug discovery, जैसे मैंने आपको बताया, that is the drug discovery where the animals are used, for the different types of studies. And this is what the all slides are there. These days, the animal experimentation are generally used in the last. Why? Because we do all kind of studies before actually evaluating the drug for the through the animal experimentation. And these are some of the ways where we generally evaluate the drug in terms of different activities before actually use the animal experimentation, right? But the selection of the animal is one of the most important steps in the preclinical studies, and you all aware the animal experimentation is always face the criticism. You all aware of those who are doing the B form, those who are doing the M form. Demonstration of animal experimentation is totally discouraged, and sometimes it is banned. You cannot use the animals for just for demonstration, although we can use the animals for the experimental research. For research there is a no ban, there is a no barrier is there, but even then if you are using the animals for experimentation, you need to justify the need of the animal for the experimentation, and that is what this whole story is there, right?
Sir,
And this
sorry for the interruption. Slide is invisible right now. It is currently a blank slide.
it is on the, अभी कौन सी स्लाइड दिख रही है आरती आपको?
Currently blank slide here.
Can you see the slide?
No, it's completely white.
एक मिनट, just
Can
wait.
you present it again, sir?
Okay, just wait. नेट का कुछ इशू है, मे भी शायद मेरे यहाँ तो सही चल रहा है लेकिन मे भी शायद, जस्ट वेट, नेट का इशू है, वेट, लेट मी ओपन इट अगेन। आरती मुझे बता देना बीच बीच में जहाँ पर है। विल यू बी एबल टू सी दिस स्लाइड नाउ?
Yes, sir. Now it is visible.
Okay, it is covered.
Yes.
I was not discussing the how many animals, ये दिख रहा है आपको स्लाइड?
Yes, sir. Clearly visible, sir.
So this was the slide basically talk about the how many animals we are using in preclinical research, and this indicate that so many animals are being sacrificed just for collecting the information about the animals, or drugs, This is one of the report that appeared in one of the journal where they said how many 1,000 lakhs of animals are generally killed just to collect the data about the drug, whether they are safe or not. But most of the time what we are feeling is, as when we start with the preclinical research, number of animals are sacrificed, but when we reach to the clinical trial, only one or two drugs they pass. So there is now a great questions are there, why we are failed in the clinical research, whereas the same drug is showing the very good result in the preclinical research. And that is what now the concern is there towards the alternatives, right? So although alternatives का हमारा topic नहीं है, we will not discuss that alternative, but what we are going to discuss is the 3R concept. Just wait. Right? Aarti, can you see the slide change?
It is moving. Yes, sir.
Yeah. तो मुझे बता देना when the slide is not being
Yes.
changed, right? So this
Okay.
slide which is talking about, most of the times we generally use different types of the animals in the research, and most of the times we generally use the mouse as a experimental animal, followed by rat and other type of species for different types of research. For example, drug research, education, other type of toxicity studies, vaccination research, and then cancer research, or different types of research where we generally use these experimental animals, But out of these, mouse and rats are widely used as a experimental animals in different types of research. And there is another concern is there, when we use the animals for experimentation, we generally try to induce the situation of the disease in the animal. And that is what we generally create a situation in the animal by giving different types of situation, or you can say different types of pain, distress, we generally create the situation in the animal. And that's what we generally says, it is a list of the torture that we generally do on the animals in order to induce the disease condition, which is clinically entirely different from the experimental situation. And this one of the reason is there, which generally drug fails when we test in the clinical trials, right? So there is always an argument. What is the argument? Argument says whether the animals are truly providing the correct information for the clinical research or not. So it is generally said that there are so many situations, or you can say there are so many conditions are there which animals are not able to produce their correct picture of the drug. For example, side effect. For example, different types of situation which the humans beings easily showed that cannot be predicted or cannot be guaranteed, cannot be easily evaluate or produce in the animals experimentation, right? So there is always an argument whether we need to conduct the animal experimentation or not, or what are the things. So there are two ways are there. One who is in the favor of animal experimentation, they says, okay, for the saving of the life of the human beings, it is not problematic if we sacrifice some of the animals, right? It is just for the benefit of the human beings. Whereas the other group, which is also against the animal experimentation, they says it cause a lot of suffering to the animals, and the disease condition that produce in the animals, they are not truly representing the human clinical disease conditions. And this is one of the arguments are there. But when you compare benefit versus risk, you will find that it is very important to experiment on the animals in order to make the new drugs, in order to invent new drugs. Then if we sacrifice few animals, then there is no harm. But sacrificing of the animal need to be justified. We must have some rationale. Whatever the experimental protocol you are using, whatever the experimental procedure you are using, it must be justified, or it must be rationally, it must be ethically correct before using the experimentation on the animals in these studies. So that is what we says, the animal experimentations can be considered or acceptable only if it gives you more benefit as compared to the risk, right? For example, you can say that if it is more risk to the animal, then there should kind of an experimentation should not be allowed, right? It is in human beings, we generally say the declaration of Helsinki. You need to evaluate benefit versus risk in the experimentation. Then if we evaluate, then that kind of experiment can be allowed, right? So what the animal welfare talk about, why we are discussing this, because this is very important to understand before actually we start from the 3R concept, So what is animal welfare? Welfare talk about when we use the animals for the experimentation, the animal must be free from hunger and thirst. It must be free from discomfort, pain, injury, and behavior, fear and distress. If the animal is free from these kind of things, animal can express themselves easily. They are generally produce the correct picture about the drug or their behavior. Otherwise, if the animal is in the hunger thrust mein hai, animal cannot behave or in a normal fashion. So it is difficult whether the drug is producing effect or the animal itself causing the problem. Right. So in India also there is a Prevention to Cruelty Act is there, where they talk about the chapter 4, that is experimentation on animals. So there's talk about all the different kind of the rule regulations are there in the Prevention to Cruelty Act, that is 1960, and that under chapter 4, 5, 6, 17 is there regarding the up to 20 regarding the animal experimentation. So one has to see. So in India, we generally ensure the ethics by the CPCSEA, which is now the name has changed. Now it is a CCSEA. It is a P has been removed. So now the correct name of the CPCSEA is CCSEA, Committee for the Control Supervision on Experiment on Animals. That is what is there. So the CCSEA is generally the currently in India control the experimentation of the animals. And this CCSEA is generally taking care of the registration of the animals. They're talking about the monitoring, inspecting of the animals. All the animal related activity is being controlled, monitored, maintained by CCSEA, right? That is what is there. So no need to discuss, because we generally, you all make and study easily the different role and responsibility of CCSEA, right? So let me come to the important thing, which is very important when we talk about the ethics, right? So there are different general ethical principles are there when one has to start the experiment or when one has to allow the experimentation of animals. It is not because the animals are available, then you can use it. It is not correct. Only the experimentation which give you new knowledge, which give you new information about the experimentation, that kind of experimentation should be allowed on the animals. Otherwise, just for demonstration, no animal should be allowed for experimentation. And always use the animal which are lowest in phylogenetic. What it means? Lowest in phylogenetic का मतलब है कि जो एनिमल जितना छोटा होगा उतना ज्यादा उसका फीलिंग ऑफ एक्सप्रेशन कम होगा. जैसे पेन है, as compared to large animal, small animals are generally preferred. And this is why now you must have seen that people they are using zebrafish, people they are using Drosophila. There are different kinds of animals are being used for the experimentation. And sometimes there is a big question the students ask whether they are also under the preview of Institutional Animal Ethics Committee or not. The answer is yes. Every biological experiment, whether it is done in the small organism, whether it is done in the large animal, all are under the preview of Institutional Animal Ethics Committee. So one has to take the approval before actually perform the experimentation on the animal. And that is what is the correct ethical way of doing the experimentation. Now, with this background, let's talk about the concept of 3R, which is को मैंने बोला कि अब हो गया है 5R concept, right? Otherwise, it was a concept which was given by the Russell and Birch, who generally give the concept of the alternative to the animals. But nowadays, we generally use this 5R concept. So what is 5R indicate? It is indicating the replacement. It is talking about the reduction, refinement, rehabilitation, and reuse of the animals, right? So let's discuss one by one. These are concept, and then we can open this discussion for new questions, right? Okay. So let's talk about what is replacement. As you all are aware of, replacement means the replacement of the large animals with small animals. That is one of the replacement. Second one is you can replace the animal by some other alternative methods, which is can also be called as replacement, right? So there are two terms we generally use. One is called as the absolute replacement, and second one is called as the relative replacement, right? So absolute replacement का मतलब है when we change the animal by some other models, that is called as absolute replacement. और relative replacement का मतलब है when we use the blood, cell, tissue of the animals for the experimentation, then it is called as a relative replacement. And one can use either absolute replacement or relative replacement when we design the experiment. And that is what people, they are now encouraging the use of alternatives, non-animal methods to achieve the same aim and objective. And you can think of even UGC, different governing bodies of or regulating body, they are also discouraging the use of animal experimentation in the in the undergraduate or postgraduate teaching. For research, it is no ban, but for the teaching, for demonstration purpose, one cannot be allowed to do the experimentation on animal just for demonstration purpose, right? Now when we talk about the replacement, you can think of different replacement. For example, you can say that in vitro technique is also one of the replacement, where you are not using the entire animal, you are using the tissue of the animal. Isolated study is also a replacement of the large animal. So why we are saying replacement? Because you are not here wasting the entire animal, you are using the tissue of the animals so that you can take number of tissue from the same animal, and only one life of the animal or one tissue of the one animal of the animal is used for the entire experimental series. So that is what is called as a replacement. Even you can also use the replacement is, you can use the microorganism as a replacement, you can use the other blood sample of the animals, that can also be a replacement. We can also use the dummies, you can use the computer modeling, they are also a part of the replacement. Now there, every replacement methods have their own advantage and disadvantage. For example, when we use the animal model, which is generally designed or developed based on the pre-existing knowledge, right? So replacement is just a method to study the concept. But in true science, replacement cannot be the entire absolute method to replace the animal. Animal is a dynamic. It gives you more information which is not there in the literature. It may or may not, but the model is based on the previous existing knowledge, right? So it apply known principle. When we use the replacement, we apply the known principle to make the new model, right? That is or alternative system, right? But disadvantage of replacement is the new model is may not explore the new information which is not there in the literature earlier, because living system is always a dynamic. It provides every time new information when we do the experimentation. So the replacement has its own advantage and disadvantage. So one of the alternatives, I can give the simple example that how the people, they are using the replacement. Earlier we used to sacrifice the rabbit to know whether the female is pregnant or not, right? But nowadays you all aware that we have a in-house ELISA kits are there, and that kits are easy to know, or with the help of these kits, it's easy to know whether the female is pregnant or not by taking the urine sample of the female. Earlier, we used to do the sacrifice the rabbit in order to assess whether the female is pregnant or not, because we need to evaluate whether that hormones are releasing or not in order to assess whether the females are pregnant or not. So this is one of the replacement which is nowadays widely accepted among the scientific community as a testing model. Either this is the same way is n number of replacement methods are available nowadays, which are widely used among the patients and in the situations. Now, second one is the R is the reduction. Reduction means reduce the number of animals in the experimentation. And this is one of the areas where institutional ethics committee always reduce the number of animals in the experimentation, right? So reduction is basically to minimize the number of animals needed to perform the experiment. Now, why we need to reduce the animals? Because in order to justify the rationality of the experiment, it is correct that we need to use the fixed number of animals in the experimentation. But in where we are not sure whether we are getting the result or not, it is better to do or test the drug in few number of animals in order to know whether our dose is correct or not, whether our procedure is correct or not, instead of wasting the entire 5 animals or 6 animals in a group. That is what is called reduction. Reduction can also be done by using the or by conducting the some pilot studies. Pilot studies means instead of doing the all animals in one group, let's try with 1 or 2 animals whether we are getting the result or not, whether the experiments are performing correct or not. In order to do a titration of the dose, we can do the reduction of the animals, right? So this is some of the hit and trial methods are generally used in order to reduce the number of animals in the experimentation. The idea is to prevent the wastage of the animal, to prevent the life of the animal, wasting the life of the animals. Then we need to follow the reduction. Now, these are some of the strategies that generally we as scientists can use to reduce the number of animals. For example, we need to design a sound experimental design actually before using or planning the animal experimentation. It is very important that to design. Now, what is design? Design means layout experimentation. Layout of the experimentation is very important. How many animals would be used in the entire experimentation, and how we will use in a phase manner of the experimentation is also one of the idea. Then pilot studies. Well, थोड़े animal में करके देख लो instead of taking the entire animals in one group. Then retrospective analysis. Retrospective analysis means we generally go back. Literature क्या कहता है? Whether the experiment has been conducted or not, right? Whether the पुराना कोई data है नहीं है, उसमें क्या dose use हुई है, that is called as retrospective analysis. Retrospective analysis give you a lot of information when we perform the prospective trial, prospective studies, And then ethical review. Every experimentation has to be reviewed by the ethical committee in terms of ethical procedure that is being followed in the experimentation. And then reuse of the animal. As far as possible, always try to reuse the animal, which is nowadays called as fifth R. I'll discuss in the fifth R is reuse of the animal after washout period. Yes, that can be used. Depending upon the type of the drug that has been used in the previous experiment, you can reuse the same animal either for the naive animal or in the control animal in order to produce the same situation, right? Then harmonization of the guidelines. Sometimes we generally follow the different papers. So it is very important to always plan the experiment by following the ICH guidelines or OECD guidelines for the animal experimentation. Never go without guidelines, right? So when you ask the animal based on the guidelines, we never say no to you for the experimentation, right? Third one is the refinement. What is refinement? Refinement means to follow the more refined method so that we'll create a less pain into the animals, less suffering to the animal. The experiment which cause less suffering to the animal is always preferred as compared to the experiment which are causing more trauma, which cause more suffering to the animal. I can give you a simple example of bypass surgery or open heart surgery, right? So you can see of these days people always or physician always prefer to do the bypass surgery instead of the open heart surgery, which cause more trauma, more suffering to the human beings, And same thing is there if you are using the more refined method, which cause less trauma to the animal, that need to be preferred. So that is called as third R that will cover it now. So we can also follow the refinement by making the changes in the experimental procedure to cause less pain and trauma, right? So these are some of the methods are there for refinement. For example, setting up of the earlier endpoints. For example, we are conducting experiments of chronic studies where we are not aware of when this drug will produce a effective curative result. Then we need to understand whether our objectives are fulfilled or not. For example, we are doing some experimentation and our result achieved earlier. then we can stop the experimentation. There is no need to create suffering for a long period of time when our endpoints are meet at the earlier setting, right? So these were one of the way to refine the experimentation. Similarly, receiving adequate training prior to performing the procedure. You can see that in the form B. In the form B, we generally check it always that whether the experimenter or the scientist uh, uh, what is the word? Whether the scientist is have a training or not, experience in the animal experimentation or not, right? Because unless until they have experimentation on the animals, we cannot do this, right? So proper, it is very important, Just wait. So this is very important now. Okay. Another one is the proper handling techniques for animals. Unless until we have a experience, unless until we have a training, it is simply a crude way of handling the animal. So unless until we have a training, we know the experience, we never allow anybody to touch even the animals. So that is also part of refinement, right? So you can think of, so this is a way we can do refinement approach when we follow 3R concept. And this is the fourth R, which is there nowadays, is called as rehabilitation of the animals. Rehabilitation, it says after the experimentation, animal need to be allowed to live their own life. You cannot have any right to sacrifice the animal after experimentation. If your experimentation does not allow to sacrifice the animal, let the animal should live their own life. Animal can be sacrificed only in the situation when the animal is not able to survive, perform its vital function. वाइटल फंक्शन मतलब दैट इज एनिमल खा नहीं पा रहा है, पानी नहीं पी पा रहा है, एक्सेसिव पेन में है, then it is better to sacrifice the animal. Otherwise, animal need to be allowed to live their own life, and the cost of living has to be bear by the scientist concerned. And fifth R is called as reuse of the animal. Reuse means as far as possible, always try to reuse the animal for the experimentation, right, after washout period. That is what is there. So these are the different ways we can use the animal experimentation, or 5R concept is there. Apart from this, there is a proper use of animal in experimentation is also very important when we'll talk about the ethics. For example, animal should not be in the pain, we should use the anesthetics, we should use the sedation when we perform the surgery or any experimental procedure. So there are different anesthetics have been approved by the CPCSCA, CCCSCA for the experimentation. You cannot use any other anesthetics or euthanasia procedure, right? So these are the moral responsibility of the scientists, that they must follow these 3R or 5R concept for the experimentation, right? So these are all about my brief small talk regarding the ethics and 3R concept. So let me conclude my talk here as the use of the animal in the research is not a right. But it is a privilege. You cannot misuse your right. Animal can be available only if you are generating new information, new knowledge. Then animal can be used for the research. It is not for demonstration. Even you must have seen that in the circus nowadays they removed all kind of animals which have been tortured by different ways. So it is a responsibility of the every researcher to ensure that this privilege should not be misused. And that is what you must be aware, that these days even the regulatory bodies, they are also allowing only the alternatives to the animals. If alternatives are available, then there is no need to use the animals for experimentation. And one has to use the 5R concept even if you want to use the animal. So 5R concept has to be followed. If you have to use the animal, there is no replacement is available, there is no alternative is available, then you need to follow the 5R concept if you are bound to follow the animal or use the animal experimentation. So that is what all from my side. Thank you.
Thank you very much, sir, for your valuable knowledge on 5 hours concept in experimental pharmacology. And I hope the knowledge shared by you will help the young brains to think more of the alternative to animals or non-animal methods for experimental purpose, and which is the future need. And you have also highlighted the role of ethical guidelines, which are considered as an important part of any experimentation. So we really appreciate your time and effort, sir. Thank you very much once again.
Thank you, Aarti. Thank you.
Thank you, sir. Thank you so much.
Thank you, Dr. Siddharth.
Thank you, sir.
Thank you very much.
Thank you,
Thank
sir.
you. Thank you.
Aarti ma'am, you can stop the recording
Okay.
before left the meeting.
Okay, sir.